in which we resort to gamifying the worst things RFK did this week. This is America Dissected. I'm your host, Dr. Abdul El-Sayed.
And I'm your host, Dr. Katelyn Jetelina.
And we're recording this on Tuesday, July 29th at 2 p.m. Eastern Time. So, Katelyn, I saw a delightful video of your daughter being from San Diego. How was that?
Amazing. What video did you see?
Her surfing. It was so cool. Yeah.
That's right. So we went camping this past weekend. We caught a spot like last minute, went camping on the beach. It was the most beautiful weekend. And yeah, she got up on a surfboard. She's earning that zip code.
Looked all the San Diego you could imagine. So, and it was like
brand.
The thing about all you people from California, which is like all of us Midwesterners who look like we're trying very hard even to do like simple things. Y'all make everything look kind of effortless. Like that's kind of like the California vibe. It's just like everything is just like a chill day at the beach.
It is.
And so she just kind of got up on the surfboard. I was like, damn, that's awesome.
I
surfed one time and definitely, man, it looked like I was putting a lot of effort not to get up on the surfboard. So
yeah, I mean, but also she's what, like 5 years old? Like she less fear than us adults, like less weight to bring up, so yeah, but we were all cheering her on. It was great.
That's awesome.
Yeah.
The Midwest equivalent of that is water skiing.
Oh, I love water skiing.
Yeah, water skiing is fantastic, but it's always like, the first time you get up, right? Because getting up is the hardest part, and similar to surfing. I remember watching, I remember the first time I got up, right, which was a whole thing. I was super excited about it. But watching these kids just sort of like get dragged through the water a couple times and then finally kind of just pop up. You know what I mean?
Yeah.
And it's just so much fun to watch. So
it is. It was great. How was your weekend, Abdul? Did you go water skiing?
I did not. I wish I did. I was doing the thing that I do almost all day, every day nowadays, which is travel my state and talk about politics. So
yeah, it's important though.
Decidedly less delightful, but still got to meet some really great people and grateful for it. So, all right, let's jump right in, shall we, Katelyn?
Let's do it.
All right, so let's update on HHS. There is an RFK or a MAHA headline in the news like almost every day now, and it's really kind of hard to know what to make out of these headlines. So we decided to introduce a delightful little game. So, we'll let you sort of pick our brains on some of these headlines. And Katelyn, I'm going to go first. I'm going to read you a headline that came out recently, and you tell me if it makes you A, panicked, B, just a little sus, or C, it's all good.
All right.
The first one. Ready to go?
Let's go. Let's do it.
The FDA's panel debates antidepressants in pregnancy. What do you make of this, Katelyn?
Little sus, a lot sus. I guess I'll explain. Yeah. I mean, so this was the situation. So last week, RFK convened a panel to review the safety of SSRIs, right? And this is a drug class of antidepressants like Zoloft, for example, or Prozac during pregnancy. And I'll get to like why I thought this happened. It wasn't entirely clear. But as this panel unfolded, I think it was about 2 hours, it was very clear that of the 10 panelists, 9 were known critics of antidepressants, particularly in pregnancy. There was actually also a few conflicts of interest New York Times reported about as well. And the discussion was very concerning. It was very suspect, right? It was overwhelmingly focused on the treatment's risks while ignoring the benefits and the devastating risks of untreated perinatal depression, which is actually, there was this 2020 study done in MMWR at CDC, which depression and mental health is the leading cause of maternal death in the United States now. I think it was about 20% of maternal deaths or perinatal deaths are due to mental illness. And so I don't know, this, it was kind of surprising to me. I'll be honest. I thought, a few months ago that the most damage RFK Jr. would be around vaccines, but it seems that nothing is untouchable and very concerned around SSRIs. And to me, and I'd be curious to hear your thoughts, Abdul, is like, why even have this meeting? What is even the danger of a panel? Well, one is we saw last week, it went viral through social media, right? A ton of moms just had a lot of questions around antidepressants during pregnancy. Rightfully so. I mean, it was pretty concerning things that this panel was saying, and very unbalanced. I think where they may be thinking about is a black label on SSRIs during pregnancy. These black box warnings are usually made when, there's a very clear evidence of a very high risk, undeniable danger that we do on other, medications. Because we don't have randomized control trials with SSRIs, we have to depend on observational studies. And there seem to be a little risks, but not huge. And the benefits are often orders of magnitude higher than the risks. But I think that's where they would be going with this. Abdul, what do you think?
So the best I can do to try and explain what's happening here is that RFK, his whole approach is to lead by vibes. It's like things that ought to be true are assumed to be true. And usually when you talk about medication during pregnancy, we're extra careful about testing medications during pregnancy because you need to make sure that you're treating both patients, mom and potential baby, right? And so if there's an impact of the medication on fetus, there's an added level of concern that that anyone ought to have. Now, one of the things we understand is that A, SSRIs are really quite safe, and B, postpartum depression is real and really quite dangerous.
Yeah.
And so, you want to protect mom and baby. Of course, everybody does. But one of the important things you can do to protect mom and baby is to make sure that mom is not suffering life-threatening depression as soon as baby is born. And that's what postpartum depression is. And so this is intended to protect against that. Now, when I say vibes-based, right, their whole point, right, one of the sort of unevidence-driven or evidence-opposed theses that RFK Jr. seems to want to believe is that SSRIs are completely unnecessary, dangerous, and a creation of the pharmaceutical industry to make money. Like that's his thesis. My wife, Sarah, is a psychiatrist, and there is not, a week that goes by where she isn't just saying, it's amazing what just a little bit of an antidepressant can do for somebody who has been suffering depression for a very long time. These are medications to treat a disease. And in the underlying of that, right, is this notion of stigmatizing mental illness as if they're not real illnesses. Like that's really what this kind of goes back to. So their argument is these aren't real illnesses. We should not be treating them with medication. Ergo, all of the medication is just a creation of the pharmaceutical industry to make money. And we should be particularly worried about situations like pregnancy. Like that's what's driving this.
Yeah.
And there is no evidence to substantiate it. And it's extremely dangerous because we know what the consequences of untreated postpartum depression can be for mom and baby. And this to me is like really quite worrying. Where they go with this, I don't really know. And I'm concerned to watch, right? Because most of the time for them, they want to use the federal government to just ask questions, to drive a whole lot of mis and disinformation, right? To undercut what the evidence has demonstrated. Because here's the thing about it. The people who tend to be the loudest in these discussions tend to be people who have had bad experiences. And nobody has ever said that there aren't situations where there are unintended consequences of any medical intervention. But if you read the balance of the conversation, you have to remember that there's a selection bias effect. But they're really counting on that to drive a conversation that is going to hurt a lot of people. And I worry that you get into a situation where, these medications that are life-saving medications for people who need them aren't available. And you hear these terrible, terrible stories of things that happen. And Katelyn, I appreciate your point on the evidence, right? 20% of peri-pregnancy death, right, happens as a function of mental illness. And, we say that, but I want folks to understand what's actually happening here. And I, offer a bit of a trigger warning. When somebody dies of mental illness, usually what you're talking about is either homicide or suicide. Like that should be clear. Let's talk about that for what it is.
Yeah.
And that's what we're talking about right now,
Yeah.
is somebody having crippling mental illness after having a baby, and it's treatable, and you're taking away the treatment, and you're creating a situation where somebody may be more likely to take their own life. And for what?
Yeah. Uh, I don't think they're just asking questions here. I think there's always a play. And I think you're right. So would you call that panicked or sus? That's why I was having trouble with this, Abdul. Like it's sus to then become panicked?
I'm not quite panicked
Yeah.
yet, but I'm a little bit more than
Don't
sus. Like
trust it.
I think
In
we need like
between.
a third option, which is like deeply concerned.
Deeply
But then
concerned.
like we're epidemiologists, so I feel like that's like just our general way of being. It's like deeply concerned, and then it's weird because like the epidemiologist way
That's
of
pretty
being is like
cool.
deeply concerned and skeptical at the same time.
Yeah. All right, then I have one for you. Oh, we can add it one of those categories. Here is a headline. Kennedy intends to overhaul federal compensation for vaccine injuries. Are you panicked, deeply concerned, a little sus, or all good?
I'm deeply concerned,
Yeah.
and let me just explain why. On its face, the idea that we should be compensating people who have had unintended consequences of anything, that seems like a great idea. The goal here, though, is not about the compensation. The goal here is about creating a platform over which to broadcast those stories so that it seems like the only information you hear about vaccines is about vaccine injury. Now, I just want to be clear. Every single medical intervention has the possibility of unintended consequences. The whole point of taking medication is that the intended consequences are better for you than the unintended consequences are potentially risky or bad, right? That's why we vaccinate people. So the consequences of getting polio are substantially worse than any risk of vaccine injury caused by the polio vaccine. So they try to pit the argument as if to say that we're all saying that these things don't happen. What we're actually saying is that the risk of getting the diseases that we're trying to prevent against is substantially worse. And there are reams and reams of historical data, like literally videos that you can show that prove that out, right? And what they're trying to do is create a platform to try and make a different kind of argument that in a information environment like the one that we live in, right, you can make go viral. And like that is the goal here. So that's what makes me really deeply concerned. Katelyn, what do you think?
I agree, Abdul. There's also these ripple effects that I don't think people are really thinking through. And this goes back to the mid 1980s. And the whole reason we have the National Vaccine Injury Compensation Program in place was because in, I think it was 1986, there were activists, parent activists, who believed their children were harmed by vaccines. And like you said, there's always risks with these. The challenge is that pharmaceutical companies don't make that much money off of vaccines. And so the cost of these trials, these litigation trials, eventually reached a point where it was more than what the vaccine manufacturers were actually earning from their products. So actually, many vaccine manufacturers stopped making vaccines in the mid 1980s because of it. It
Mm.
didn't make financial sense to them to do so. And the handful that remained were contemplating doing the same. And so that's why Congress stepped in and did this National Vaccine Compensation Program. It granted a few things. One, pharmaceutical companies legal protections and this basically no fault compensation system under HHS to reduce the burden of proof for petitioners who felt like they were harmed by vaccines. It's also created this system where it's paid on this tax of each vaccine dose. And there's no perfect program, and there has been a lot of push to reform this over the past couple decades, right? All the way from increasing max compensation to making the system more efficient for parents to adding more taxes to new vaccines on the schedule without Congress having to act. And a lot of these efforts were bipartisan and led from Democrats. But it comes back to what we were just talking about SSRIs, Abdul, and the underlying motivation of RFK of just wanting to let this go loose and really not thinking through those ripple effects on the whole system and why we put these things in place in the first place. And I don't know. We'll see what his move is, but it could be I mean, it could have really big implications for access to vaccines.
And I really appreciate that story just because, the whole central argument that underwrites a lot of what, this policy by vibes is about is this notion that pharmaceutical corporations make these medications only to benefit themselves. But like, they just don't make that much money on these drugs, right? Like, this is not one of those blockbuster drugs that you make a lot of money on. So the whole notion that you undercut all vaccines because somehow it's just a profit making gig by pharma doesn't really make sense. Now, look, again, I'm going to say this for like the 15th time. I do think that pharma has some really bad practices when it comes to their own corporate greed. But that's more about overcharging for the medications we need than it is about making unnecessary medications and peddling them to us. So, anyway.
Okay, Abdul, one more headline. RFK Jr. is taking an axe to America's dietary guidelines. Panicked, deeply concerned, a little sus, or all good?
Honestly, a little sus. Like, I, I just don't think our dietary guidelines are that great. I think too often there is clearly the lobbying influence by big food. And I think there's an opportunity for us to rethink it. Do I think he's going to get it right? No. But like, we'd probably be replacing something that was like not that great with something that's not that great. I would love to see a 100% evidence driven and more nuanced guidelines. I don't think we're going to get that out of this administration, but I don't think we've gotten that out of most administrations in the past either. And I just want to be clear, right? I actually think that if there's one upside to what RFK Jr. is doing, it's that he's forcing a broader conversation about nutrition in this country. I just think he's defined the right problem and, as usual, has the wrong solution.
Yeah.
Getting rid of red dye is not going to fix the issue, right? Rethinking our corn and soy subsidies, that might fix the issue. But I don't think he wants to do the hard work of actually doing that. So we'll see. What do you think?
Yeah, we'll see. I mean, there's a few things I want to see in the report. And you're right. I mean, the last report, so this is done every 5 years, right? Last report was 150 pages long, right? So, like, that's not helpful. But so I want to see it shorter. I want to see an emphasis on health equity and flexible and inclusive patterns, dietary patterns. Would love to see stuff on portion size, would love to see things on incorporating guidelines based on, behavioral science. Because even if guidelines are amazing and perfect, Americans just don't follow them for really systematic reasons. Right. So, and we'll see also the whole ultra processed foods. I thought they missed the mark there. They're a bit too conservative last time and missed an opportunity to highlight how quickly this evidence is growing and what we're learning from it. But you're right. I mean, this is this RFK. We'll see what happens when that comes out.
It's interesting to watch the food space change very quickly. And I think more people are thinking very critically about what they put in their bodies. I just never underestimate the power of a huge corporation to try and adjust around what is latest and newest and greatest in the zeitgeist, right? Like, the amount of times that you see the word protein on you name the processed food, right? And they'll say like, this is a great source of protein. And you're like, is it though? Right? Like, what does that mean? It has protein in it. Like, almost all food has protein in it versus, is this high protein? And also, like, to what degree should we all be eating that much protein? Like, I say this as somebody who tries to get 180 grams of protein in every day, but I also say this as somebody who like is thinking very critically about all the things that will make my body use my protein, right? Versus just saying, actually, yes, get all kinds of high protein. Like, to what end? Not clear, because some fitness influencer said you should, but like, are you doing the exercise part of that? Like, is that, or is it just like, we're going to get protein, so we're going to be eating healthy? Because we've heard various versions of that: low carb, right? Low fat. I mean, so just because it's one of these things doesn't mean it actually makes sense. And corporations are really good at selling you a thing that they think you're going to want based on vibes. And so look, I think, I'll be honest with you, I think they have a better chance at getting this one right than any of the others. So I am rooting for the American public to have high quality guidelines. I do hope that they get it right. I will not be surprised if they massively F it up, because this is, you know, when your middle initial is F, like, it's kind of part of the vibes. So
It's
it is
on
what it is.
brand.
It is Robert and Kennedy. Anyway, I guess I shouldn't be that. There were other FKs that were that were substantially better statespeople. We'll just put it there. All right. So, Katelyn, moving on. Wanted to check in on the measles outbreak in Texas. We haven't talked much about this recently, but you've been tracking it all summer on YLE. What are the numbers, and what does it tell us about where this is going?
I know. So we actually got some good news, guys. That
Hey,
I
wait a
know.
second. Wait a second. Is this the America Dissected podcast?
We have
Are
good
we talking
news.
about good news?
Yeah. Thanks to those on the ground, public health and the communities, this was the first week we didn't have a measles case in this southwestern outbreak of Texas, New Mexico, Oklahoma, and Kansas, which is really big news. It's not necessarily time to celebrate. I mean, it needs a few more weeks. I think it's 3 weeks of no cases to signal the outbreak has been contained and it is officially done. But I love this news.
That is great news.
It is. I mean, for a few reasons. One, parents don't have to worry so much, especially the younger kids, which I could only imagine how stressful that was in West Texas if I had
Mm.
like a kid under 6 months. Also, this is policy implications, right? We were all kind of wondering how long this outbreak would take. And if one outbreak, doesn't matter which one, sustained longer than 12 months, then we would lose WHO's elimination status in the United States, which basically would mean measles is endemic. And so if this has been contained, that means our elimination status is still protected for now. We'll see. But I think that this is a huge testament of a few things. One, like I said, public health, local public health, putting in all the work and the hours, communities, community leaders, people getting vaccinated when they weren't previously, which is really scary for some people. And then I think also this virus burned out. It's so contagious that it stopped finding pathways to infect. So I don't know. I think that is a win.
I want to put a fine point on that last piece with individuals doing the things that they needed to do to protect their families, because that's like really what this comes down to.
Yeah.
Even when you talk about like big picture public health infrastructure, it's us making a decision as a society to build that infrastructure to invest in our collective well-being. And I think sometimes all of us in public health assume like this is an obvious thing, but if you're out there in the world and you're hearing all kinds of information designed to scare you, to have the courage to step up and say, you know what, I'm going to do this thing because I want to protect my kid from this thing I obviously see around me. That courage is important, and I think we need to applaud it when we see it.
It's huge. There was a lot of people that got vaccinated that weren't previously vaccinated. And you're right, it does take a lot of courage.
So the other disease that all of us need to continue to think about is COVID. And over the last couple of years, we seem to have seen an uptick in the summer. What can you tell us about what we're seeing right now as we head into the month of August?
Yeah. So COVID has spiked every summer for the past 5 years. We expected epidemiologists. I guess I'll speak for myself. I actually expected a pretty big summer wave this summer because we had a very small winter wave, right? A lot of people are susceptible to infection. But we're seeing right now COVID increasing, but it's like very wimpy. It's only increasing linearly. It's not really increasing exponentially. If we look to our neighbors over in the UK, they had a very wimpy COVID wave, which means to me, I think we're also going to have a wimpy one. But we'll see. Some states are increasing a lot. Hawaii and Florida are having pretty sizable COVID waves right now. So we'll see. I don't know how this is all going to play out. I'm very curious, Abdul. I'd put your epi hat on. I'm curious your thoughts. If you think this is slowly but surely becoming another coronavirus, and we'll have smaller and smaller waves as we go, or if this is just an infant virus that we still have just no idea how it's going to act. But it's really interesting to me we're not having a big summer wave right now.
Yeah, and let me decode that that point you just made for listeners. Right before the coronaviruses were just another class of viruses that we bundled into common cold. Right, like that's how before COVID-19, that's how we thought about coronaviruses. Right? So for listeners who, for the first time they heard the word coronavirus in association with COVID-19, I want folks to understand that like before this one, we never really thought about them as these like big, massive, very deadly diseases. Um, and I think, I'll be honest with you, I think we're starting to see a sort of reduction in the seriousness given just how deeply this has penetrated in society over a number of waves. But I also just, want to remind folks that like this is probably going to end up being something like the flu, and flu still kills tens of thousands of people
Yeah.
every year, right? And so even though this is not to the degree where we're watching it so closely and all of society is being moved around it, these diseases, even when they're endemic, are still really serious. And COVID has the capacity to kill and will continue to have the capacity to kill. Likely over time. And so we're probably going to end up having some waves that are meh and other waves that are very serious. And then over time, you're going to start seeing the amplitude of those waves start to decline, right? And every once in a while, probably see like a more notable spike. But I don't think we're going to be back into where we were. The other thing I just want us to remember, though, is that, as the circumstances continue to change because of climate change, as we're seeing more animal and human mixing, as we're seeing more reductions in the spaces that wild animals can venture without touching humans, as we're seeing our weather patterns change over time, this creates the circumstances where the next one and the next one and the next one come. And I just think, because this has been such a massive part of all of our lives who lived through it, it's easy to think, okay, well, we weathered that one and we're done. Well, no, what we should learn is that this is a risk that we are going to continue to live with, so long as we are watching as the circumstances that create it continue to get worse. And what's even worse than that is all of the investment we should have made post COVID-19, right, to protect ourselves from this thing happening again. All of that investment not only hasn't been made, but we've actually broken apart all of the infrastructure that was supposed to protect us. It's like we got in a big accident and then we got saved by an airbag, and we didn't like the way that the airbag punched us in the face. So the next car we got, we specifically took the airbag out. And you're
Yeah.
like, well, I don't, getting hit in the face by the airbag sucks, but it's a lot better than going through the windshield.
Yeah.
But that's what we're kind of setting ourselves up for.
It is. And just to make that point clear, Abdul, like you're saying, yeah, COVID is still killing people. I mean, even with this small wave, I actually looked up the numbers earlier this week because I was curious. 125 Americans are still dying per week from COVID-19. And I think this is actually one big reason it hasn't really and won't for a while turn into one of the common cold coronaviruses is because older Americans weren't exposed to this when they were younger. So they don't have the memory. Their immune systems don't necessarily have the memory to keep remembering what this coronavirus is. And that's why they have to, really important to get vaccines every year.
Mm-hmm.
So their immune system does remember what COVID-19 looks like, and doesn't surprise in another big wave. So we'll see where COVID takes us.
We got to remember, right? This is the acute version of COVID. There are hundreds of thousands of people who are currently living with the chronic version of COVID-19, right? Long COVID. And for them, this is not over. And then the other thing about it is we actually don't really know what the long-term consequences of COVID-19 are. Like anybody who's ever dealt with shingles, I just want folks to understand like shingles is chronic chickenpox. That's what shingles is. And we don't really know what COVID-19 is doing or if it's sort of gone into hibernation somewhere in our body. Because like the way you get shingles is the chickenpox virus doesn't get fully defeated and it goes into hiding in in your neurons, in your sensory neurons. And then over time, when your immune system wanes, it'll come back down those neurons, down the axons into the part of your body that those neurons innervate. And that's why you end up getting like this really weird sort of patch of shingles. And that's a thing that like we don't know what COVID does. It's plausible that your body fully defeated it. It's plausible that it didn't. And we don't really know what's going to happen like decades from now if there's some chronic form of COVID-19 that we don't even know to deal with, right? Because we do know that we have long COVID and that's like subacute COVID, but we're not even talking about like decades on. And so I don't want folks to walk out and think, oh, well, COVID's over, because for a lot of people it's not. And also we just don't really know what the natural history of this virus really is, simply because it kind of hit us all at one time and nobody has lived with it long enough to actually know what it can do decades on, like other viruses can do.
Well, and we're finding this with other viruses too, right, Abdul? It's not just chicken. I mean, look at EBV and multiple sclerosis, right? Epstein Barr. Now I can't even look at the word Epstein. But, so I mean, that's another example. I know that there were some studies in the mid height of the emergency around why we were losing our sense of smell from a COVID-19 infection, and some of those brain scans of like actually impacting the gray matter in our brain could potentially, right? We're not sure, but have impact on Alzheimer's. So for example, in a few decades. So you just don't want to mess with these viruses, man.
No.
Not at all.
So one more story today that I do want to get into. So Katelyn, do you track your steps every day?
I don't.
You don't? So I do. I'm
I'm sure
gonna
you
take a
do.
look at my steps today. I'm sure it's very low. Actually, I went for a run this morning, but um, let's see. I'm at 7,635 steps. My daily average is about 12,000. And obviously, we've all been taught that that magic number is 10,000 steps. But that might not be quite right based on your most recent reporting in Wiley. Can you walk us See what I did there? Can you walk us through what the most recent evidence suggests?
Yeah, there's this fascinating study that was published last week or the week before. It was a meta-analysis. So basically, a bunch of other studies pooled, and they found that it's around 7,000 steps delivers the ultimate effect for
So you're saying
cardiovascular
I can just
disease.
sit down for the rest of the
So
day? I'm
you're
good.
just done, Abdul. Just tap out.
I'm done.
And it's a big deal, right? Because 10,000 can be tough to reach. And so I was curious this past week. I was like, where the heck did 10,000 steps come from? Like, is that from a study? Like, where did we get that benchmark? And the more I dug, the more it was really interesting. So, this number, the 10,000 steps, came actually from the mid 1960s. A Japanese company started a marketing. It was basically a marketing campaign right before the Japan Olympics in the mid 1960s. And they created this logo for this product and they used the Japanese character for the number 10,000 because it looked like, like a stick figure walking person. And it just like stuck. It's almost like 60 years now that we've been thinking about 10,000 steps. So I think the bottom line is, one, this isn't too surprising, right? Exercise is good for us, even if it just means walking and getting that blood flowing. I know I can do better at that. I think what was even more interesting about this study was that the most dramatic impact was actually from step count from about 2,000 to about 5,000. And because
Mm,
that's where we're getting people out of that sedentary zone, right? We're getting people moving, and that alone can improve blood pressure, blood sugar, improve inflammation. And so I think the bottom line is, yeah, at least get a minimum of 5,000 steps, go for the 7,000 steps. Anything additional is fantastic for mental health and I'm sure other physical health reasons. But it's an attainable goal, I think, for a lot of Americans.
that's awesome. And also the other lesson is get yourself a mid-century Japanese marketing firm, because wow.
Those things just end up sticking, which is pretty incredible. But speaking of good marketing, Abdul, tell everyone who you talked to this week.
Yeah, so we had a really great conversation with the Funkle on TikTok and Instagram. He is the public health uncle. He's a public health educator in New York and a social media persona extraordinaire. His name is Dorian Johnson. And his whole thing was, how do you talk about public health issues in ways that don't make you sound like you're talking about public health issues? Because let's be honest, like, for all of you all who hang out with us every week, we're deeply grateful. But like we know that that we can get a little boring. So the Funkle is here to save us all by trying to translate public health into language that people actually want to listen to. How do you go from information to content in an era where there's just so much more content, and you're competing with everything else out there on the internet to provide people information that's really, really important. So, if you're listening and you've been nervous about posting or trying to share information that you think is really important, I think this conversation will be for you. So, hope that folks will stick around. All right, Katelyn, any big plans for the week? Traveling at all?
I'm not, which is oh, actually I am. I'm going to Houston this weekend,
I'm sorry.
which I'm
No offense
not
to anybody in
excited
Houston.
about.
Also, Houston right now is like truly the worst
Yeah,
humidity, like the worst.
it is not a good time to be going to Houston, but my
No.
my niece is turning 1, so that'll be
Oh,
fun.
that's a good reason to go to Houston.
Yes, it is a very good reason.
That's awesome. All right. Well, enjoy it and safe travels.
All right, bye, Abdul.
All right. Can you introduce yourself at the tape?
Of course, my name is Dorian Johnson. I go by the Funkle, Public Health Uncle, and I'm a public health educator and health communicator in Long Island, New York. I believe that education for health should be skills based and focused to help people while we also work upstream to change systems, giving them something they can do now while we work towards better outcomes.
I love that. It's so you have to tell me the origin story of the Funkle. How did you become the Funkle?
Absolutely. So, I'm someone being one of the few Black men in public health. I felt as if my voice was something that was underrepresented in something I really didn't see like that. And I was like, huh, culturally, we got uncles. Like, we got Uncle Snoop, we got Uncle Charlie, we got uncles that really be looking out for their like young ones coming up after them. And there's a rich auntie, if you will, where it's the aunt is putting game to the nieces and like the young ones after them to help them avoid pitfalls and obstacles and things they don't really need to worry about if someone could just help them. And I was like, I like teaching, I like making it fun. PH, public health, Funkle. And honestly, my wife came up with that. So credit
Well,
to her always.
I love it. And tell me, you work out of Suffolk County, but you're also thinking both locally and also globally. And there's something about great communication which is free of scale, right? It doesn't really matter where you're doing it. The themes build off of each other. Can you give me a sense on, how did you fall into public health and really see yourself as a public health educator in terms of as a calling?
Yeah. And what's interesting about that is I didn't know public health was a discipline until I was 28 years old. So, with that, I actually thought I would be doing sociology. And my sociology professor was like, I know exactly what you want to do. I wrote your letter of recommendation for grad school. So, I know where your goals are at. Have you heard of public health? And I said, what are you talking about? So, from there, I was really able to clearer than ever see, okay, it's not just health a sole responsibility as I've been led to think at one point. And coming from someone who was working on an individual level with personal training and then later group fitness, I was seeing trends and patterns emerge where people in specific zip codes, people in specific neighborhoods, they were all experiencing the same thing. And I was like, there's more to this. Like, I got to keep going upstream, and how can I kind of merge like that one-to-one individual with coaching and actionableness, for lack of a better term, with having them do stuff they can in the interim while we're like doing more upstream stuff. And I've gotten pretty good at educating by doing that. From like every client is different from the next, even if it's the same problem, so to speak. So that is something that really guides my perspective and just my approach.
I really appreciate that. I want to before we talk about what goes right with how you communicate, it'd be helpful to step back and sort of understand from your perspective what goes wrong when we talk about communicating public health. What are the things that we continue to do wrong, that we continue to miss when it comes to the way we talk about everything from vaccines to the kinds of preventive behaviors that we can all engage in?
Whew. Yeah, that is a very big one. Um, what I do feel something that does keep going wrong is assuming that trust is automatically given. And I feel like a lot of that is shielded behind what advanced degree you might have, or like if you're a doctor or any sort of thing that is always respectable. Like people do work hard and invest a lot in their education and just creating this path for them. I do feel that is used as a crutch to where I have this amount of education, therefore you automatically respect me. And I feel like that could create discord, especially if it's someone who is coming from, let's say, not that community or someone who is an outsider. It's just that assumption where trust is automatically given and not earned. And I feel like that is a big sticking point.
Yeah, I think you're entirely right. So, as one of those people who used to always lead with, well, here are my degrees and here's all the education I have that you might not. I've come to appreciate that more importantly, people want to understand the things that are similar between us. And I think when you create that chasm between you and someone else that is based in degrees that you got to get, you miss that opportunity to connect on a basic level, right? People don't really want to know what my medical degree tells me they should do when it comes to vaccines. They want to know what my being a father to two daughters tells me I think they ought to do when it comes to vaccines. And I think that's the mistake that we so often miss. And then the other part of this is that there has been a concerted effort to turn those degrees against you, right? That there
Mhm.
is this idea that somehow there is this conspiracy of people who've gone to fancy educational institutions. Those folks are all trying to get you to do something that's not in your interest. So it's not even that the degree that you have buys you trust. It's that the degree that you have is going to be used against you to take away trust from you. And I think we're still operating in this environment where we forget that point. And then, there's another point that I think you're really good at understanding, which is that if you're not talking in stories, if you're not capturing somebody's attention because what you're saying is itself interesting to listen to and fun to be a part of, people are just going to swipe, right? You got to create content, and that's something you've done really well. You're really candid in the way that you show up on social media, and I want to ask you now that we've talked a little bit about what we get wrong. What have you found helps you get it right when you are communicating in broader, more public spaces in these ways?
Thank you for that, by the way. I appreciate that. One of the things I feel that I have been able to accomplish pretty well is being able to urge surf with seeing people just throwing out inflammatory or even just like combative language. If I post something, there is false equivalencies being drawn, there's people attacking me and my character. And I feel like the just inherent instinctive thing is to like bite back, but I don't. And I feel like I want to. And I feel like quite often, given a lot of the things and the stakes that go with the type of work that we're in. But I always just take a pause. I feel that urge. I have it get to the top. It crashes down. And then I'm in that space where I seek more clarification. I seek more understanding. So let's say I like post something and I kind of think I know where they're going. I just ask them again for clarification. So if I'm hearing this right, can you just like speak more about that? Or like, what does this look like? Tell me more. And a lot of times I allow them to share where I'm getting insights from that I feel like I wouldn't have gotten if I just like bit back or like punch down or like anything. And even if I still disagree, I feel like other commenters come in as well and like push or rally behind that initial comment where I'm like, it seems like a lot of people have this perspective too. And I think that's insight. Like, what can I do differently, or how could I adjust my message, or something like that, where I think that's a very big skill, just urge surfing
Mm.
when you see something like that.
What's interesting, what I hear you saying is that in order to do this well, you almost have to resist the incentive structure that's laid out for you by social media, right? Because so much of social media is geared toward figuring out how to maximize your emotional experience with the material in ways that leave us yelling at each other rather than speaking to each other. And it's almost like if you're going to be a super user in the way that you are, and too often I'm forced to be. You've really got to be able to sort of zen out of the ways that it's pushing you to behave, and to be thinking about how you use the tools for your benefit and to move your message, rather than the way the tool moves you to use it. And there's sort of a meta concept of like, what is the implicit curriculum of social media? And I think the mistake that we often fall into is that the world is its extremes, that like you have the people who wholeheartedly agree with you or the people who wholeheartedly don't, because those are the only two folks you're fed information from, because those are the folks that are going to elicit the biggest surge of emotions and the neurotransmitters that follow them. And you almost have to keep your eye on like, what's that silent middle, like that movable group of people who don't already agree with what I have to say, or don't already vehemently disagree with what I have to say, who I can start to persuade and to engage with. And it's important, right? Because if you want to do this well, you almost cannot consume the material the way that it's intended to be consumed, or you fall into the mistakes that too many folks end up making, and you start speaking in extremes, because that's the implicit curriculum of this thing. And you talked about urge surfing. Like I'm wondering, how much social media do you consume, or how do you consume it as somebody who creates it regularly?
Yeah. Oh man, I am chronically online. I feel like I shouldn't be. I feel like I should step back for a lot of the reasons that you mentioned. When it comes to when I end up creating and how that like diverges from like how I consume things, I primarily look for trends or trending sounds, and generally they have formats. Like if there was something, it's generally following something where I plug in a public health scenario, or I plug in a perspective of something that I think should be amplified to make it more visible. So like I guess on my seeking as like I'm consuming mode, I see what is out there and then I try and bring it back to public health. And when it goes to creating, I also kind of am like, what is something that I feel someone might need to hear? And are there any trends that kind of like overlap with this right now that I could leverage for like some reach or some visibility? And I try to keep it just like that. What design tricks and this and that, like I give myself time limits because I know I will stay on there way too long.
You're also somebody, though, who's focused in the local. How have your experiences in Suffolk changed the way that you create material? Is there a way in which you're sort of borrowing from the local space that you're in to better understand how things are going to move?
That's a good question. I will say like a lot of things that I do see locally inspire me to create something about it. Where right now on Long Island, there's been a huge uptick in just like ticks, specifically sightings, bites, whatnot. So I'm like, let's talk about tick safety. It's timely. It's like during the season. This is something that, yeah, I'm speaking to locally, but also people not in my same geographic area, it could still kind of remind them, yeah, tick stuff is important. I could also be susceptible. So I feel like a lot of things I see like on the ground are things that also influence me to create.
I want to give listeners sort of a sense of how you work. There's a couple of examples I want to bring to the fore. I want to play one now about STIs. I want folks to take a listen, and then we'll talk a little bit about it, why it worked, how you came up with it, and maybe folks who are out there talking about these issues, particularly in this moment now where we're watching, the Secretary of Health and Human Services weaponize against vaccines. Some of the insights here I think can be helpful. Let's take a listen.
Oral sex does not mean it's risk-free. For example, did you know that you can get gonorrhea or chlamydia in the throat and you might not have symptoms? So that means you could pass it to other people because you don't even know you have it. And generally, you have to ask for a throat swab. There are other STIs that don't show symptoms in the genitals too. So no burning, no bumps, not itching, but could still be actively infected. So imagine you have an active infection, aren't showing any symptoms so you feel like you're fine, then have a sexual encounter. That's a possible transmission. And this is why routine testing is so important with every new partner, every couple months, throat swab included. Lastly, forget body count. Remember biology. Someone can have multiple partners and have no STIs. Someone can have one partner and get a STI. STIs only care about one thing, happen from one to the next. So how'd you do? Did you know these 3? Share with someone who might need to hear this.
All right, so that video got 82,000 impressions. Can you give us a sense of what were you trying to move beyond? I hear that explicit piece on body count there, which is what people tend to think through. What were you trying to get folks to rethink about STIs?
Yeah. One, that it isn't primarily just front genitals and where like they could live, or even, the anus. Just I used to do STI testing, which kind of goes back to things that I've done which influence what I've created. And a lot of times in questionnaires, people were shocked, even where it's like, I didn't know that I had to get throat swabs as well. I didn't know that there was a risk to this. And up to a point, like in my own life and experience, I thought that way too. So a combination of this, the something that has cultural significance of just the concept of like a body count and what that means, and all that that could potentially symbolize. I feel like if that's a focus and a topic, what could I teach around that topic, especially something that people might not know, and like fusing those together. And that was like the intent behind that. Because even in the comments, there were people who were like, I had no idea. How could I ask my partner? I'm nerd, like, and that leads to other more skills based health education that I could provide. And that's the main goal for me. But seeing just that, like, and like leveraging a topic that already exists and also teaching.
I love it, and I think the fact that you're not your material doesn't come out sounding like a usual sort of public service announcement. You're not afraid to go right there where people really are, but you're doing it in a way that is not stigmatizing and fully approachable. I think that's absolutely something that folks can get right. I mean, pausing here, why don't you think enough public health agencies, if this can be so effective, talk like this?
That's a great question. A couple things are coming to mind. I do wonder if there is any sort of model that agencies could create things similar to. Like when I think about teaching specifically as a learner, modeling is so important to me. Like every time I'm like, do you have examples? What could this thing look like? Am I too in my head? Like I feel like it kind of goes hand in hand with, does something that has gotten some traction or some success exist, where it's kind of like a proof of concept where, oh, okay, this resonated with this community. This is something that seems to have landed. Can I do something similar like that? I think there's something there where maybe nothing exists, so to speak. So it's kind of back to same practices, same traditional ways of doing things. And I think there's an opportunity for that. And I guess another gap, I suppose, that could lead to other agencies not adopting it is just, are there shareholders or constituents or like things that create red tape that we don't want to be perceived as such? And that's, I don't have a potential solution for that. Like the other one, I was like, oh, modeling. This one, I do not know, but I could imagine.
In a word, it's stigma, right? Like I think people are
Yeah,
afraid of sounding a certain way. They're afraid of how messaging can be used against them rather than how messaging can be used to achieve the outcome that they want. It's actually fascinating how much messaging is done defensively, especially in public health, because we're so afraid of who we're going to offend rather than whose mind we're going to move. And you hit that stigma topic head on in one of your videos, and I want to listen to that as well because I think you unpack a number of issues here that I think are really important for us to be thinking through.
Public health often uses stigma as a strategy, and historically it has worked. Smoking rates dropped. But to get there, we didn't just make cigarettes look gross. We also made smokers look disgusting, weak, selfish. And that shame and association stuck with smokers and smoking for decades. So is it a win? Is it not? Here's the thing. If we're not careful as public health practitioners, We can very easily repeat this pattern. We use shame to push healthier choices in sanitation, maternal health, obesity, and mental health. And that shame and stigma hits the hardest for those who are already marginalized. As public health professionals, we can't dismantle stigma and actively destigmatize if we don't understand stigma.
So that's a really helpful video because I think you're really kind of capturing part of what we just sort of talked about in terms of why sometimes we don't talk like this, because I think too often you're right, like we're actually on the wrong end of leveraging stigma as a tool, but we don't really pay attention to the unintended consequences. And so much of what you're thinking through are the intended and unintended consequences of communication. Can you give us a sense of why you wanted to make a video like that and who you were trying to talk to in terms of what you wanted to change with that intervention?
Yeah. So that was actually during Mental Health Awareness Month. So I thought it was very timely for that. And who I was looking to speak to are just, public health professionals and just people who might kind of understand stigma, or at least like they're aware of it, but really don't know how it could look other than quote traditional ways of it looking. So, and also just kind of straddling the nuance and lines of like, well, public health has stigmatized smoking. And I wonder if people might say, well, it works for smoking. Why can't we try that same thing for increasing opioid occurrences, where I would advise against that based on things. And it's just one of those things where the topic is reckoning with what we've done in the past to hopefully lay down something in the future. And I feel like a lot of times that's a big acknowledgement that public health professionals need to make as well, where say people are going in communities that have been burned before by outsiders, it's very common to not act as if nothing happened. Like you have to confront and share the past transgressions and collaborate moving forward to not leave them out again, and also like involve them in solutions. And you see this type of model with peer led opioid interventions, and it's kind of like that learning from the past so we could avoid future transgressions. And that was something that I felt like could be helpful with just what stigma looks like for smoking and how hopefully we don't do something like that again.
Yeah, I really appreciate that, and I also think that it's critical because your perspective is one that's often missing in the conversation. It's like who gets left out. I mean, you're a black man in public health, as you talked about. There are not that many black men in public health, despite the fact that too many of the outcomes that we focus on disproportionately impact black folk and black men. And I I want to ask you, as you think about this, as you think about the way that you're coming at this, can you speak to the ways in which your own experience, feeling both included or excluded from the public health discussion, shapes the way that you come at discussions like this and what you want to share and how you want to share it?
Yeah. So some things that come to mind immediately are a lot of people I've seen, whether it's like family, friends, parents, and things growing up. I've seen so many black men die before the age of 50, before the age of 60. Like, it's something that is very shocking, quite frankly. And you even see things going down even lower to, I just, in a sentence, want black men, black people to be able to have the opportunity to grow old.
Hmm.
And a lot of that, it's it's rarer than it needs to be. And you see that from all different walks of life, all different income levels. Like growing up, I remember with my brothers, we would always watch like 106 in Park or like Rap City and stuff like that. And like I see literal rappers who die at 50, die at like 60, don't even have that longevity. And like at that point, like money might not even be a barrier. And it's just, when I think about ways to reach specific demographics, is there anything that specific people can leverage to be more relatable, to be more able to be listened to and heard, and can the audience be more receptive to, like being someone who works in a county where they just hit their 25th anniversary of their smoking cessation program that they offer, as far as me being a Black man, and only, believe I was told I was the first Black male educator. Like, there's a whole mentals population in which, like, it will not come the same way from other people that it can come from me. And that's something that's needs to be acknowledged. There's different dynamics at play that could make it land more or make it land less, but it's a lot of being able to be the person. The message can be good, but like the messenger is also important as well. So that's a strength. Like, that's something that, if it's there, it's worth experimenting with, it's worth implementing, and that might not be an opportunity that presents itself. So having those specific people and just like using what I've seen to like influence how I want to show up, and hopefully being that, like, in like barbershops, people have shared, like, I don't trust doctors. I've seen what people have done. I've seen what happened in my life. And I don't know if they've ever had that chance to talk it out with someone who looks like them, or understand where those beliefs are coming from, or what their fears and concerns are, in a way where it could be met with productive conversation instead of some sort of demeaning or dismissing or anything that isn't productive. And it's just, I want to be that person for these communities, and just like
Yeah.
get that stuff going.
Well, we appreciate you being that person for so many communities, and it's a reminder that we need to make sure that if we're talking to a diverse community, that our workforce reflects that, and you're demonstrating exactly how possible and how critical that is. Our guest today was Dorian Johnson. He's a public health fellow in the Office of Health Education at the Suffolk County Department of Health Services, and he's the public health uncle, the Funkle. We're really grateful to you, Dorian, for all you do and for joining us today to teach us a bit about how you do it.
Of course. Thank you so much for having me. I appreciate it.
That's it for today. You can find more content at our website, incisionmedia.co. Check out our shop at store.americadissected.com for our new America Dissected merch, including logo shirts, hoodies, and mugs. And don't miss our Vaccines Matter, Science Works t-shirts. If you have guest recommendations for the show, send us an email at info@incisionmedia.co. You can follow or subscribe to America Dissected on your favorite podcast platform and on YouTube at America Dissected. You can follow me on Instagram, TikTok, and Twitter at Abdul Al-Sayed. No dash. You can make sure to subscribe to Katelyn's newsletter, Your Local Epidemiologist, which breaks down the latest scientific evidence for over 300,000 readers. Search for Your Local Epidemiologist on Substack. Links to all our sponsors are available in the show notes. I really do hope you'll check them out and show them some love. They make the show possible every week. Finally, on our way out, don't forget to leave us a 5-star review. And if you're watching on YouTube, drop us a like or comment. And word of mouth still goes a long way too. So if you know someone who might like to keep up with everything that's happening in the world of health, please do let them know. America Dissected is a product of Incision Media. Our co-host is Dr. Katelyn Jetelina. Our producer is Andy Gardner-Bernstein. Video and audio editing by Nadine Melkonian. Our theme song is by Taka Suzawa and Alex Uguera. Sales and marketing by Joel Fowler and Nick Freeman at Big Little Media. Our executive producers are Tara Knight and me, Dr. Abdul Al-Sayed, your host. Thanks for listening. This show is for general information and entertainment purposes only. It's not intended to provide specific healthcare or medical advice and should not be construed as providing healthcare or medical advice. Please consult your own physician with any questions related to your own health.